Best intervention for panic attack? Schizophrenia hallucination type? Lithium toxicity symptom? Anorexia nervosa main sign? Phobia definition? Main PTSD symptom? Side effect of benzodiazepines? Primary bipolar disorder symptom? Dementia characteristic? OCD main feature? Schizophrenia negative symptom? Alcohol withdrawal symptom? Most abused substance? Common antidepressant class? Delirium onset? Narcissistic personality trait? Borderline personality trait? Antisocial personality trait? Suicide risk factor? Lithium requires monitoring of? PTSD treatment? Depression key symptom? First-line schizophrenia drug? PTSD first-line medication? ADHD primary medication? Alzheimer's early sign? Common opioid withdrawal symptom? Long-term effect of heroin? Main eating disorder treatment? First-line anxiety treatment? ECT is used for? Common hallucination type? Avoid this in schizophrenia patients? Panic disorder symptom? Lithium long-term effect? First response to suicidal patient? Tardive dyskinesia cause? Best setting for dementia care? PTSD triggers? Main concern with MAOIs? Agoraphobia is fear of. Common side effect of SSRIs. Common benzodiazepine. Main ADHD symptom. Alcohol withdrawal treatment. Opioid overdose antidote. Cognitive therapy goal. Clozapine risk. First-line bipolar treatment. Schizophrenia acute phase goal. Manic episode priority intervention. Best approach for paranoid patient. Delusion of grandeur example. Serotonin syndrome symptom. Best diet for lithium meds intake. Priority with violent patient. Hallucination response. Risk factor for depression. ADHD men treatment. Common PTSD emotion. Defense mechanism in PTSD. Anorexia electrolyte imbalance. Primary concern in delirium. Alcohol withdrawal time frame. Conduct disorder behavior. Main concern with borderline disorder. Side effect of clozapine. Bipolar mania first-line med. Primary schizophrenia concern. OCD best treatment. Early alcohol withdrawal sign. Panic attack first intervention. Borderline disorder feature. Best response to suicide threat. Autism early sign. Opioid withdrawal symptom. ADHD primary symptom. Schizophrenia thought disorder. First-line PTSD therapy. Dementia irreversible cause. Negative schizophrenia symptom? Medication for alcohol dependence? Therapeutic communication avoids bipolar disorder key symptom? Autism key feature? Lithium toxicity sign? Therapeutic communication avoids which? Common opioid side effect? Phobia treatment? Antidepressant onset time? Priority care in schizophrenia involves? Common benzodiazepine side effect? First response to panic attack? Conduct disorder trait? MAOI dietary restriction? First step for suicidal patient? Most common OCD compulsion? Common PTSD symptom? Best intervention for agitation? Anorexia primary concern? SSRI risk in young adults? Keep it up, future nurse.